If you or a loved one is suffering from Parkinson's disease, you need to learn about deep brain stimulation and how that can really help. Here is Dr. Arif Dalvi to tell you more about it. Dr. Dalvi, welcome to the show. First time to have you here. Hopefully you'll come back many more times. Good to have you.
Thank you for having me.
It's our pleasure. So there's this technology that is both new and old that we're here to talk about, this deep brain stimulator programming. It's been around for a little while, but it's maybe more in vogue now than it was, and maybe it should even be more in vogue.
I think it's one of the areas in medicine that can have a tremendous impact in terms of quality of life in patients with Parkinson's disease and in patients with tremor. A simple way to think about it is like a pacemaker for the brain. If you have abnormal electrical rhythms in the heart, we put a wire in the heart connected to a pacemaker that brings things back to normal. In Parkinson's and tremor disorders, there's abnormal electrical rhythms in the brain, and when we put an electrode in the brain connected to a pacemaker, we're able to bring things closer to normal.
So this technology has been around for a bit, right?
Yes.
What makes it superior to previous technologies, previous operations?
Well, previous surgical techniques that we would use involved actually burning a stroke in the area of the brain. And as you can imagine, when you burn a stroke, there's no going back on it.
What do you mean by burn a stroke?
We would put in the mapping electrodes, and through that area, you would actually create an area in the brain, a small area that is, in a sense, heated up and destroyed because the tremor cells lie there. With the new technology, since you're putting an electrode in the brain, it's reversible. So if the lesioning is not exactly on the spot, you can reverse it and change parameters and help the patient and have good benefit without side effects.
Right, I was going to ask you, so there won't be any side effects?
The risk is much lower with the new technique than it is with the previous technique.
And for the actual surgery, you and I were talking about this before, the patient is awake?
Correct.
Yeah.
So interestingly enough, the brain has no nerve endings. So when we put a mapping electrode into the brain and when we put the actual stimulating electrode into the brain, the patient does not feel any pain whatsoever. On the other hand, the patient needs to be awake because we're actually testing the patient out. We're looking at their tremor, looking at other signs and symptoms, and when we turn the device on in the operating room, the tremor stops. We know we're on target.
It's no pun intended, mind-boggling to me, maybe slight pun intended. How long is the surgery?
So the mapping part of the surgery can take anywhere between 2 to 5 hours, and usually that's done at a single setting. The subsequent placement of the pacemaker usually is done about a week later, which is a shorter procedure.
And for both of them, the patient's awake?
No, for placing the pacemaker in the brain, the skin has plenty of nerve endings, so you need anesthesia for that.
Okay, right, okay. So we talked about the quality of life. So who might be eligible for this?
So in the setting of Parkinson's disease, there are 3 types of patients who benefit. The first is people who have a tremor that just won't respond to any medication. We call it an intractable tremor. The second type of patient is somebody who has dyskinesias, involuntary movements. Michael J. Fox comes to mind when you think of involuntary movements in the setting of Parkinson's. So if these go bad and if these cannot be controlled by medications, DBS surgery has a role. And then the third type is patients who have a fluctuating response to medications. So even though the medication works, it does not last until the next dose and wears off, and these are called motor fluctuations that can be very disabling.
How do people get Parkinson's? Is there anything that we can do to avoid getting it?
So in essence, it's basically a combination of genetics and environment. There are certain ethnicities in which there's a strong familial incidence of Parkinson's, but a large number of patients that I see don't have a family history or don't have any genetic risk factor per se that we know of. There are certain environmental factors people have looked at. Living in a rural area, drinking well water, for example, increases the risk of Parkinson's. But in essence, it's a combination of genes and environment that in a bad combination, when they're put together, give rise to Parkinson's.
What about the usual culprits, cigarettes, obesity, alcohol, things like that?
Interestingly enough, cigarettes are one of the things that are inversely correlated with Parkinson's disease. But for the most part, we don't have any dietary or any lifestyle risk factors that are specific for Parkinson's.
Are we close to a cure? Do you anticipate a cure coming?
Well, in some ways, the medication that is used for Parkinson's, carbidopa, levodopa, is a very effective medication for the first 5 to 7 years. But then when patients have more difficulty, then surgical treatments like deep brain stimulation surgery are very important. And in the pipeline in terms of research, although it will take some time, are things like gene therapy and stem cells.
So after the deep brain stimulation procedure, what kind of life can a patient expect to have?
So the whole idea behind performing a surgery of this sort, which also has its risk, is to give back quality of life. What I tell patients who are going to go for the surgeries, don't think of it as a cure, but think of it as a way of setting the clock back on your disease by 5 years, 7 years, if you're lucky, even 10 years. So they have a better response to medications, they have much less tremor, they are able to go about their day-to-day activities with much less difficulty than before the surgery.
Are they able to, I guess it might depend on the person, can they exercise, can they run, can they have a quality of life that someone else might have?
Absolutely. I have a patient with severe tremors who was unable to eat or drink or write because of the tremors. We put in pacemakers for both sides of his brain to help his tremor in his hands. Last I hear, he was scuba diving to a depth of 25 feet. So, a very different lifestyle compared to before the surgery.
That's got to make you feel good.
It does, it
yeah,
does.
That's what
we
it's
live
all
for
about,
that
right?
as physicians.
Yeah, of course,
right?
That's what it's all about. All right, where can people get these procedures?
So in this area, we are offering it at Delray Medical Center, and the evaluations to decide whether you're a candidate or not are done at Delray Medical Center in my office or my office at Palm Beach Neuroscience Institute. Probably the best way to find out about us is through the website pbni.com, palmbeachneuroscienceinstitute.com.
And you actually touched on what I was going to ask you, which is how does someone know if they're a candidate? What kind of tests do you do?
So we subject patients through a detailed clinical evaluation. It's called a Unified Parkinson's Disease Rating Scale evaluation. We also subject them to neuropsychological evaluation, make sure there's not significant dementia or depression. And then if necessary, we will test patients off medications and on medications to decide if they're going to be good candidates.
And the last thing I want to ask you is, I know we already talked about food and cigarettes and alcohol, but this might seem like a silly question. Is there anything that we can do to sharpen our brain? Like, again, apologize if it's a dumb question, crossword puzzles, things like that, mental challenges.
Absolutely. I think physical exercise is one of the best ways to sharpen the brain. So, going for a walk, going for a run, going for a swim, these are some of the best ways you keep your brain sharp. But also, learning a new language, learning a musical instrument, playing a game of chess, playing Sudoku, things of that sort can be very helpful in the long run.
So it wasn't a dumb question.
It was not at all.
Dr. Dalvi, great to see you, and we'll have you back again soon. Okay?
Thank you so much.
You got it.
Bye-bye.